Some of the leading ways that we might manage stress, especially for thinking about heart health, we're thinking about ways to increase social connections. We know more and more in the field of cardiology and healthcare overall that social connections, they are actually quite protective of our health, and people who have strong social ties actually do have better health outcomes. So I'm working with people on finding ways to increase their social connections. We're also working on things like relaxation training, so making use of different techniques, whether it's mindfulness or breathing techniques, but different tools that can actually help us to calm down our nervous system in the moment and to give our bodies a break. And we're also working on things like fitting in opportunities for meaningful, enjoyable activities. So again, being able to continue to do the things that matter to us, even if it looks in a slightly different way. Self-care, plus learning new coping strategies, plus building up our social connections. I think that these are all really important pieces of managing stress. Everyone knows that certain things like refraining from smoking, trying to not drink too much, getting a regular amount of exercise, eating in a certain way, we know that these things are good for us, and especially for our heart health. But it can be another thing entirely to practice and carry out these habits, and not just in the short term, but to carry them out in the long term. So there are different stumbling points that can just make it hard for people to do this, even when they're very much invested in making these changes. And so this is where working with a psychologist can come in handy. So once somebody has been established and is working with me, even if they just need a couple of visits to get started with a new habit change, they may choose to follow up with me in 6 months or whenever is needed, whenever they think that they need to get back in to see me, so we can meet again and we can fine tune and I can give that support. If people are interested in working with a psychologist and they see a need, whether it's dealing with the stress of the heart condition, whether it's wanting support in implementing some of the complex recommendations they've been getting, if they want a helping hand, I'm here for any and all of those types of needs.